All right, so let's get started. I'll just keep an eye out on the participants coming in and we can keep letting them in. So welcome everybody. My name is April Garrett and thank you for joining us today for our Seniors Blue Book University. If you are not familiar with the Seniors Blue Book, Seniors Blue Book and seniorsbluebook.com is a free resource for helpful information about senior care, retirement living, and a host of other relevant topics to seniors, older adults, and caregivers. If you're not familiar with our guides, they are available. We actually just printed our 6th edition and it's available right now at Walgreens entirely free. But also, if you would like to receive any free copies, my contact information is right up here on the screen, or you can also visit seniorsbluebook.com and you can request copies there entirely free. Thank you so much for joining us today for Seniors Blue Book University. We had decided about 5 months ago to start these monthly presentations with the goal to really just educate our community on local resources that are available and to cover a wide variety of topics that pertain to seniors and caregivers. Today, we have an exciting presentation on the importance of heart health, prevention of heart attack and stroke, and it's going to be presented by Lisa Hopkins, who's the Area Business Development Director with Encompass Health. And I'm sure, Lisa, you'll share your contact information, but you can also visit their website at encompasshealth.com. Lisa, are you okay with people inserting any questions they might have over chat?
Absolutely, it's not a problem.
Okay, so any questions that you have during the presentation, if you're not familiar with Zoom, just kind of hover over your screen and you'll see the word chat. You can insert a question there and we'll address it. And just another couple quick housekeeping items. We are going to be recording today's session. So if you do need to leave from your laptop, we are going to record it and send out the link to everybody's email afterwards. And it'll also be available on the seniorsbluebook.com website for future viewing. And I think that's it. I guess we'll get started. Lisa, I'll turn it over to you. I'm going to stop sharing my screen here.
Great. Well, thank you very much for having me. I am excited to be here just a little bit so that you know where I'm coming from and what my background is and why I think it's important for us all to know about this particular topic. My name is Lisa Hopkins. I do work for Encompass Health Rehabilitation Hospitals. We have 2 here in the city of Pittsburgh. We have one located in Harmarville, Harmer Township, and then we have one located in Sewickley. So both of our rehabilitation hospitals here in the city do have a very special certification. They are 2 stroke certified rehabilitation programs within the city of Pittsburgh. There are not many of those. There are only 3 in the city of Pittsburgh. That would be Encompass Health Sewickley, Encompass Health Harmarville, and UPMC Mercy's Rehab Unit. Those are our 3 stroke certified rehabilitation hospitals. And so today we're coming to talk about how to prevent a stroke so that we don't see your lovely face here within our rehabilitation hospital. And we want to talk about how to prevent a stroke. And not only that, what you do if you unfortunately suffer a stroke. So I'd like to start off first with making sure everybody is familiar with the warning signs. You know, stroke is something that does provide us with a warning before the full circumstances and occurrence happen. And this has taken over and received a lot more visibility in commercials, on the radio, with our medical doctors. And we decided as a community years ago with the American Stroke Association to talk about the acronym FAST, F-A-S-T. And if you see that on a billboard, what does that mean? And that's specifically for the stroke warning signs. F stands for face. What you will see is that either a side of your face is drooping. When you smile, your smile is not equal. It's asymmetrical. You might see that your eye looks different. It looks like you've got a droopy eyelid. But F is for face. They're first asking you, take a look at your face. If you're feeling different, if your face looks different, you know, that is a warning sign of a stroke. A is arms. So what do you do with your arms? Well, typically, if you're a healthy individual and you raise your arms up, they're going to be both at the same level. But if you are potentially having a stroke and you raise your arms up, perhaps you can't raise up one, or you can raise one up, but it's really slow compared to the other one. Or you get them both up and the one falls down because you're too weak. Anything related to just a difference in your arm ability. And we're not talking about somebody who already has arthritis or has some shoulder issues, but truly looks at their arms from a level of equalness. A for arms is the second warning sign. S stands for speech. So if you walk into your neighbor's apartment and you ask them a question and they, in return, sound very garbled, like maybe like they have a whole mouth of marbles, or they had too many drinks. You're like, wow, you're sounding like you hit the bottle of wine too early in the morning. No, that might not be the case. The case might be that they're having difficulty with their speech. Their speech might be totally clear, but it just doesn't make any sense. Like you say, good morning, Carol, how are you today? And Carol turns to you and says, the peanut butter's in the refrigerator. I'm like, well, that's not what I asked you. And they maybe are talking nonsensical and they're not just, they sound very, very confused. That's a warning sign of stroke. So we've got F for face, A for arms, S for speech, and then T is not a physical sign. T equals time. We cannot forget about these symptoms, ignore the symptoms, hope they're going to go away. Stroke occurs at a higher degree of severity if we don't get to the hospital in time. And because we have multiple stroke certified acute hospitals in our city, when you show the warning signs of a stroke, the ambulance will know where the closest stroke certified hospital is to take you. A lot of times, unfortunately, when I see a rehabilitation patient here at Encompass Health after having a stroke, the stories are very much the same. They had a symptom at night. They thought, I'll just sleep it off. It's probably something else. I'll go to bed and I'll be fine in the morning. And when they wake up in the morning, they're more severely compromised. Or they go to bed at night and then they wake up in the middle of the night and now they can't move their arm and their leg. Just the warning signs are there for us to take action, to get to the hospital. And quite honestly, anybody who works in the emergency room is going to tell you they'd rather you come in and not have anything going on and it not being a stroke than not see you at all and you never making it to the hospital because it was a stroke. So T equals time. We need to get there quickly and we need to make sure that we're okay. So let's just talk about the things that we can do to prevent a stroke. Unfortunately, there are things that we can't prevent. Those are the non-preventable risk factors. We have no control over them. One is age. We're all getting older and we can't stop that. Even if we think we're going to have some youth skin cream and miracle drug, we're all going to get older. And unfortunately, anybody over the age of 65 has a higher risk of stroke than anybody under the age of 65. And we know that. So you can't control that. Another thing you can't control, your family history. If you have a family history of stroke, if your parent has had a stroke, a sibling, a grandparent, that is a family history of stroke. And we can't control that either, but we need to be aware of it. Another one is race. We cannot control our race. And unfortunately, African Americans have a higher degree of stroke than any other race. So right then and there, you need to be on more alert. Another thing we can't control, gender. Females have a higher risk of suffering a stroke than men. I always like to say to my family, oh my gosh, you're giving me a stroke. Well, that's not a joke, but for me working in rehabilitation, they totally understand what I mean, which is that I'm about to lose my mind. I'm a female and I have a higher risk of a stroke. So that isn't a joke, but it's also not controllable. Nothing I can do about that. And then the last risk factor that we consider to be not anything within our control is that if you have had a stroke already, you are at a higher risk of having a second one. 1 in every 2 stroke patients suffers another stroke. Why is that? Do they not modify their other behaviors? Do they just have a higher risk because of the stroke that they've previously had? It's a combination of both. And so if you've had a stroke in the past, it doesn't mean you're automatically going to have another, but it does mean that you are at an increased risk of having another stroke. So those are all called uncontrollable risk factors. So what can we control? And I'm going to refer to some of my notes here because there's a lot. There's a lot within our control. And the biggest one is high blood pressure. It is the leading cause of a stroke, hypertension, high blood pressure, leading cause of a stroke, but also able to navigate and able to change. And how do you change that? Well, first of all, you need to know your numbers. Do you know what your numbers are? When is the last time you've had your blood pressure checked? For those of us who only have an annual visit, we might have some underlying issues that we're not even aware of. The research shows that there are a considerable amount of individuals that do not know that they suffer from high blood pressure. It is an unrecognizable symptom. And if they don't have warning signs, they won't know until their next annual visit. But if you're somebody under the age of 65, you might not be having an annual PCP visit. You're supposed to be, but I do know people who say, I've not been to the doctor because I don't have a reason to. I'm healthy. Well, I forgot to mute things. I'm going to do that now. I apologize for that. So the second thing that we can do, a very controllable risk factor, smoking. And I'm not going to say, show of hands, who's the smokers in the audience right now. Just know that smoking is going to increase your risk of having a stroke. The other part about the stroke with smoking is that the amount of cigarettes you consume in 24 hours directly correlates to the risk of having a stroke. Many research studies have now determined that that is a significantly higher risk than what they originally thought. It paves the way for a stroke because it makes our heart unhealthy. And that's exactly what we're talking about is heart health. And so how is that impacted? It decreases our heart health when we are smokers. So it increases your risk of developing a stroke. One of the things, a word of caution, if we have any younger folks on today, the use of birth control pills while smoking is significantly damaging to your risk of having a stroke. Doing both of those combination activities will increase your risk. So a recent study brought a couple things together. They took race and combined it with smoking. And what they found was that not only do you increase your risk of smoking if you're African American, but if you're African American and smoke, you double your risk of having a stroke. So that was a significant study that just came out. It's fairly new, but it was great information for us to have, especially as we educate people on their risks of developing a stroke and how to keep your heart healthy. So what's another thing we can control? Well, a leading cause of stroke is diabetes. And some of us know, there's type 1 diabetes. You may have type 1 juvenile diabetes. You've had diabetes since you were born. And others have type 2 diabetes. And how do you develop type 2? Much of it is related to your heart health. Diabetes can be impacted by how healthy we are, how much exercise we get, what type of foods we eat, how often we drink. All of that is determined by our lifestyle, and that also has an impact on diabetes. So if you're a diabetic, you've increased your risk of developing a stroke. And so we want to look at diabetes as an independent risk factor for stroke. You can control having a stroke by controlling your ability or lack thereof of being diagnosed with diabetes. When diagnosed with diabetes, if left untreated, meaning you're not going to the doctor, you're not following your medication routine, perhaps you're supposed to be on insulin and you don't take it, I know people who will say to me, oh, I sneak a donut. And then when I sneak a donut, I hurry up and I take my blood level, and then I change the type of amount or dosage of the insulin that I give myself. That's kind of going around what you should be doing. We want to kind of keep a very stable, as much of a stable number as we possibly can. So diabetes itself is contributed by a heart healthy diet. What happens when you have a combination of all of this? How do we impact diabetes? How do we impact our heart health? How do we impact hypertension? Well, part of it is physical activity. So if you already saying to yourself, I'm a couch potato, the lack of physical activity directly correlates to your heart health, and it correlates to having a stroke. COVID, unfortunately, had a lot of us in the house. We needed to be in the house for safety. We needed to be in the house to make sure that we were not getting COVID. We were also not preventing the combination of giving others COVID. And what we're finding right now is a lot of people have not sustained the amount of activity they were doing before. And physical inactivity, unfortunately, has went up as a direct result of us being in our houses with COVID. So what can you do if you still have to be at home, if you still have to be safe, if you still have to not go out as much? I've heard everything. I've heard people say to me, I do laps around my first floor. I'm definitely doing a lot of bending and reaching exercises. There are things called sit and be fit, where you're doing exercises from a sitting position, or activities that you can do that you don't think are physical, but they truly are. Good housekeeping around the house is physical. I don't know about you, but when I wash my windows or I run the sweeper, that's considered physical activity. It doesn't have to be lifting weights. It doesn't have to be running a marathon. It's the idea that we're physically active and we're moving around and we're moving our muscles, because physical inactivity will increase your risk of stroke. So now, thank goodness, we might be starting to see people getting out and about more as you are receiving your vaccinations, as some of the restrictions are being lifted. The best place for us to go is to have a good fresh of natural air. Parks, places that you can walk, trails that you can bike on, even just the ability to go out in your own backyard is going to help us with the physical activity that's needed to help prevent a stroke. Moving on, what else can we prevent? What else can we work on for our heart health? Another risk factor is obesity. Obesity will increase, and it is linked to a direct correlation with high blood pressure, diabetes, heart disease, and stroke. Losing as little as 5 to 10 pounds can make a significant difference. And I'm going to tell you, I know it's not easy. I joke with people. I said, if you ever go to college, you talk about the freshman 15 and how the first year of freshman college, you gain weight. And for me, I feel like it's been the COVID 15. With the lack of activity, I've heard many people say they feel like they definitely have gained weight over the last year. And if you know that you have to lose 30 pounds, that seems like a large uphill battle. 30 is just a huge number for me. So we have to take it day by day and week by week and say, if we just can lose 3 pounds over the next week or 3 pounds over the next 2 weeks and accomplish that and go little by little up with our challenge. But if you lose as little as 5 to 10 pounds, you are decreasing your risk of stroke. It's a lifelong challenge. I know many people will take small steps. Things that are popular right now, Fitbit, or a watch that measures your steps, even a cheap pedometer that you can get at your local store. It clips to your waist belt, and you give yourself a goal. You said, today I'd like to be able to do 6,000 steps. Tomorrow I'd like to be able to do 8,000 steps. All these little tiny things will decrease your risk of stroke and increase your heart health. And that's ultimately what it's about. The other interesting thing we found out about obesity is not only does it increase your risk of stroke, but it's directly correlated to what we call brain aging. So all of us are getting older, but we can prevent what age our brain thinks we are. I don't know if you've ever heard that, doing things that challenge your brain are helpful. Crossword puzzles, word challenges, a lot of applications now on these smartphones, whether they're visual challenges or spelling things, word with friends. All of this is great challenges for our brain. And what we have found is that obesity increases the speed of how much your brain ages. And so knowing that, you've already got an added incentive that you want to reduce your risk of stroke, you want to increase your heart health, and you don't want to further age your brain more than what it's already aging. So that in itself is a key indicator for why we want to reduce our obesity risk. Medical things. This is a lot. You think, my gosh, what should I work on first? There's so many to pick from. And understand the part of this discussion is you do have control over these things. We've talked about hypertension, smoking, obesity, diet. Those are all controllable. Pick one and start. It's the best way we can do it. So when we're talking about stroke, we have to correlate it with some other medical diagnoses. High blood pressure, we already know, we talked about, but we want to talk about high blood cholesterol, carotid artery disease, peripheral artery disease, atrial fibrillation. Lots of medical diagnoses, lots of medical words. So high blood cholesterol, those are your levels that you're going to get done during your annual visit. And we know that there's a good or healthy cholesterol, and then there's a bad cholesterol. The thing about it is that large amounts of cholesterol in the blood increase your risk of developing a clot. And a clot is the leading cause of a stroke. So when we have a risk factor and you already know that you have high cholesterol, we want to reduce that. We want to get it back into a regular, normal range. And how do we do that? Through things we already talked about. Physical activity, modifying your diet, stop smoking, and change your lifestyle. And that will also reduce your high cholesterol. Carotid artery disease, especially the ones in your neck, supply the oxygen to your brain. And so if you have carotid arteries, what's called stenosis, which is thinning of the arteries, you are increasing your risk of a clot and thereby increasing your risk of a stroke. Plaque will build up, and basically just like a straw that has something that's stuck in it. When the straw hole is too small, the clot cannot go through. The clot is going to form, which reduces the oxygen and cuts it off to your brain and increases your risk of a stroke. So anything with a blocked artery is going to increase your risk, and your doctor is going to tell you when you're at that risk, because there are surgeries and interventions that we can do to help that. Another thing is peripheral artery disease. It's the same type of understanding that when you have the narrowing of the blood vessels, you're going to increase your risk of stroke. And the one that has really gained a lot of attention, atrial fibrillation. I've done talk like this probably about 10 years ago, and I didn't even discuss atrial fibrillation. Not because we didn't know about it, but I think because of the strong correlation that we now know it has related to developing a stroke. When you have atrial fibrillation, that is essentially a heart rhythm disorder. So instead of it having a natural, consistent beat, the heart either is beating too fast, it's beating too slow, or it's having a change in its pattern. It is just a change in the heart rhythm. And because of that difference in the heart rhythm, a clot can travel to the brain and cause a stroke. So if you have AFib, which is the shortened version of atrial fibrillation, if you have AFib, you know that your stroke risk factor is up and you have to seek treatment for your atrial fibrillation. Typically, some things that are linked to atrial fibrillation: sleep apnea. Has your loved one ever said to you, I think you stopped breathing in the middle of the night. I think you kind of stop and then gulp in the middle of the night where it sounds like you're trying to catch a breath. Sleep apnea is very often undiagnosed, and it has a direct correlation to atrial fibrillation. It's linked to it. I have, unfortunately, a couple of those unable to control risk factors. I have family who have had strokes before me. We have a high degree of cardiac disease in my family, and I have four primary relatives, all with atrial fibrillation. And I will tell you that all four of those relatives are being treated differently. They are all on a medicine for their atrial fibrillation, and not one of them is on the same dosage, and not one of them is on the same type of medicine. They're all different. But the thing to remember is we have to be compliant with what our physician is telling us to do. I have a relative who basically was taking his atrial fibrillation pill like a Tylenol. He only took it when he didn't feel well. He would say, "Oh, I feel like my heart is racing in my chest. I better take one of my pills." I thought, what are you talking about? You're supposed to be taking your pill daily, every day. "Oh no, I only take it when I feel my heart racing." Well, this was an educated man, and he just didn't get good education about the medicine. He felt like it was only something he needed to take when he felt the symptom of atrial fibrillation. And in my mind and in his doctor's, he was non-compliant. But it wasn't because he was purposely doing it. It's because he didn't understand how to take the medicine. So if you have a diagnosis of AFib, you want to have a good conversation with your doctor about your treatment and about how you want to prevent and reduce stroke. Another thing that is something to think about is our overall heart health. How do we make it as healthy as we possibly can? Your heart is your muscle. It is a muscle. And so when you want to build up your muscles, you exercise and you go to the gym and you might work out. You might take a game of tennis. Well, how do we exercise our heart? And it's what we do and what we put inside our body. So healthy lifestyle, we have to talk about food. What we're placing into our mouth and how we eat and our pattern of eating is very important. I always like to talk about processed versus unprocessed foods. Thinking about my grandparents, they lived on a farm and they pretty much ate only something that they already had put on the land themselves, something they placed in their garden, and something that they created themselves. So everything they ate was natural. And nowadays, unless you can find Cheetos or Doritos growing off of a tree, please let me know if you do, but those are not natural foods. Those are created by man, and those are considered processed foods. So we talk about eating things that either grow from the ground or are found in the ocean. So what is that? Well, that's all your fruits and vegetables. They either grow out from the garden, they fall from a tree, and then your animals, your proteins, the things that roam the land, chicken, cow, and things that are found in the sea, fish. So if we think about just eating natural foods and not eating processed foods, we've already helped our diet. I had a friend tell me that she has literally not had a processed food in over 2 years. And I thought, oh my gosh, how do you do it? I like my potato chips. I like my Cheetos. I like my Pop Tarts. But then if you think about it, is there a Pop Tart tree? Nope, that's a processed food. And that's an easy way of understanding processed versus non processed. Have I given up Pop Tarts? I haven't, but I try to make that a reward if you really like them, a cheat meal, as we call it. You know, we can't be perfect. And when you think about changing your diet, and I hear people say, I am no longer eating any carbs, I'm no longer eating any sugar. That's hard. You know, modifying your diet, that's a little bit easier. Not eating ice cream with every meal is definitely easier than giving it up totally. And not eating the Cheetos is hard, but I'm not asking you to give it up forever. You know, you're rewarding yourself perhaps with whatever you enjoy, but the idea is that in order to keep our heart healthy, we have to modify our lifestyle. So we talked about all of the risk factors, both the controllable and the non-controllable, and the symptoms of a stroke. Now, we're doing it all right, and we still develop a stroke. We still have one, or a loved one has one. You know, I end the conversation with what do you do and where do you turn? Well, first of all, if you're going by ambulance, that you don't have to worry about that thought because they're going to take you to a stroke certified hospital. But I want you to think about where you live, because what we have found is that if you are in a more rural location, you have a higher risk of developing symptoms than a more urban location. Our hospitals are stroke certified centers that do amazing work, that do things like thrombectomies, where they go in and remove the clot. You may not have that happening at a rural hospital, but you're going to have it down here in the city. And the city of Pittsburgh is going to be able to take care of something like that surgical procedure. So that ambulance is going to get you to where you need to go. But let's say you have symptoms of your stroke and you now have issues because of it. And these issues can range from muscle weakness, not being able to move one whole side of your body, difficulty swallowing, difficulty speaking. Perhaps you have a visual disturbance or something going on with your eyesight now. Your balance may be off. I, in 26 years, have never seen one person who had a stroke look identical to another person. They've all come with different issues and concerns. And so you do want to make sure that you're getting the rehabilitation you deserve. A couple years ago, a study was completed and it was released to the Journal of American Medical Association. And it went nationally to tell physicians and educate them that every person who suffers a stroke deserves a shot at stroke rehabilitation. They not only will benefit, they deserve it. And so we at Encompass Health have talked about this, and we have truthfully tried to communicate that as often and as possible as we can to let people know that if you have symptoms and issues after your stroke, you want to ask your physician, tell your physician that you want to go somewhere for stroke rehabilitation. And the 3 certified stroke rehab centers here in Pittsburgh, we're blessed to have. The fact that we have 3 stroke certified rehab programs is so very helpful, especially when you think about cities and states that don't have that locally. And you deserve to go. And you may not have as many symptoms as you need to go in as an inpatient, but perhaps you need outpatient care. Perhaps you need some care at home through home health therapy or home health nursing. But whatever you need after having a stroke, you want to have that great conversation with your doctor to make sure that you recover as best as you possibly can. Because that's what I'm here to see the person who has suffered a stroke and come out on the opposite side, truly recovering and getting back to life and getting back to enjoying all the things they love to do. that's success for me in stroke rehabilitation. I'm going to end it with that. I know that's a lot of information. I spoke for probably 30 minutes straight, which is crazy. But if you have any questions, I would love to take them. I'm here for you.
Thanks so much, Lisa. I know we had some new people join in. If you have any questions, feel free to either unmute yourself, because we do have, I think there's only 13 people on, or if you want to just submit your questions for Lisa over the chat. For those of you who are not familiar with Zoom, just kind of hover over the bottom, you'll see chat and you can enter your question in there. Anybody?
If there isn't any questions, but maybe you're shy, maybe you don't want to ask now, please, you're more than welcome to go to www.encompasshealth.com, and you will see a section on there that's called For the Patient, and you will see a whole entire group of information specifically for stroke and stroke rehabilitation and what to do and where to turn. So all of that is at your fingertips. And if you need anything, April knows how to reach out to me, and you're more than welcome to shoot me an email or shoot me a phone call. I'll gladly take anything.
Okay. Well, thank you so much for joining. Like I said, this was recorded, so if you missed a portion, you're probably off, but if I will send it out through email. Everyone who is attending right now who's still on, I'll send it out through email, so you can access it at a later time. But thanks so much for joining us today.
Great. Thank you, April, for having me.
Fantastic. Thank you.
Enjoy your day.
You too. Thanks.
Bye-bye.
Bye.